Now, I've mentioned fiberotomies a couple of times. I'm a big fan of fiberotomies. We all know there's fibers that go from the gum into the root of the tooth. And what happens is this. This is exactly how I explain it to patients. I go, here's the root of your tooth in your jawbone. There's fibers that go from the gum to the root. When I straighten that tooth, the fibers, they stretch like a rubber band, and what they want to do is bring that tooth back to where it came from. So once the tooth is straight, I go in there, I reorient the fibers, doesn't hurt, takes like 30 seconds, but then they grow in straight, help lock that tooth in position, so we're not always fighting that tooth wanting to rotate back. My goal is to get it there and keep it there. This helps me keep it there. When you explain it like that, they really understand why you are doing it. Okay, and it's a very easy surgical procedure. You numb up the patient, you place a small scalpel blade through the sulcus down to the crest of the bone, and just try and go all the way around the tooth, you know, as much as you can. Now, if you do happen to have some thin gingiva, like maybe you would on a lower canine, for example, you can skip right at the mid-facial, okay? But generally speaking, you try to get all the way around the tooth. So here we're doing fiberotomies on some lower anteriors. That's just a small blade. I believe it's a 15. There's a smaller one, a 15C, and there's even some smaller specialty blades you can use. Numb up the patient and just slide that blade right through the sulcus till you hit bone, plain and simple, and work your way all the way around the teeth. Now, I do charge extra for these. Right now we're charging, I think it's $125 per tooth. If they have a whole bunch, like if it was someone where all 6 anterior teeth were just mega rotated, you know, I might only charge them for, you know, 2 or 3 of them. The longest time on this procedure is waiting for the numbing to kick in. And if you numb, you know, a lateral, you know, you're getting the central numb too. So I might give them a break on that. But I definitely do charge extra, especially if you're only doing one, because it is chair time and a procedure that you have to do. So basically, you know, you have this network of these supracrestal fibers. You go ahead and take your scalpel blade, and once the tooth is straight, put that right down so you hit the bone, all the way around the tooth, and then what's going to happen is the fibers are going to grow in straight and help retain the tooth. Basically, you'll end up with like a retentive cuff around the neck of the tooth. Obviously, you're not getting the fibers that go all the way down, but you get that retentive cuff, and it's really going to help that tooth prevent that rotation and relapse from occurring. When I didn't do a lot of these, I had a lot more problems with relapse with rotations than I did since I started doing these. I mean, it's just so much easier to retain rotated teeth on adult patients when you do these fiberotomies. And here's a video to show how you do it. You know, numb up the patient, and then take your small scalpel blade, and again, just put it right through the sulcus, right down to you hit crest of bone. Okay, and just kind of work your way all the way around the tooth. And also do it on the palatal side. And for these fiberotomies, I'll do them on any teeth that are rotated, say, you know, I don't know, 20 degrees. Also, if the patient said, this is a tooth I don't like, and pointed to one, and it's rotated even if it's a little less than 20 degrees, maybe only 15 degrees, I'm going to do that one too, because that's the tooth they're going to be looking at in the bathroom mirror from 1 inch away every day for the rest of their life. And if it moves, they're on the phone calling you, okay? So, you know, I like to use these on those, you know, very rotated preoperative teeth. I really feel that retentive cuff helps ensure long-term stability.
To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live-seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/PowerproxLab.